moving on, basically we'll be discussing the modes and the causes of death over here. Now, first and the foremostly, basically, it is the disease or the injury for which operation or the anesthesia was given, or it was being carried out. So it's again the main crux over here, and we are going to basically focus over here that on whatever on whatever condition the surgical procedure was performed on, this debilitating condition can itself prove to be fatal for a particular person. Now, the diseases or abnormalities other than that for which the procedure was being carried out. So even we have to take into account the other diseases or the other abnormalities that are the pre-existing conditions. For example, it can be the diabetes mellitus, or it can be any other chronic diseases, for example, hepatitis B, C, if one is suffering from, or it can be hypertension. So all of these diseases have to be taken into account over here. Now, the mishaps during or a complication of the surgery or the diagnostic procedure, they're again very important, just because of the fact that if a particular surgery was performed, and say, for example, it was performed on the intestines were strangulated by some kind of a forceps that was left over there, and it was neglected by the surgeon whosoever was performing the procedure. So again, this is going to be the neglect on part of the surgeon. So even this reasoning is fair enough, and it has to be advocated upon if the clinician is found to be guilty over here. So the fourth point consists of the mishaps during or the complications of the anesthesia being administered. So it can be basically anaphylactic reaction or a drug reaction to the anesthesias, whether it was a local anesthesia or whether it was a general anesthesia that was given during the surgical procedure. So all of these can prove to be fatal for a particular person only, and basically we'll just weigh the risks versus the benefit ratios over here and perform the surgeries on a particular person in a particular case. Now, the classification system, this is basically according to the American Society of Anesthesia. So it is basically abbreviated as ASA, and they give basically the 5 classifications for this. No serious disease is found, it is the ASA1, and if we have a serious disease but have no limitations on their activities, it is the ASA2. ASA3 is basically the serious disease and some limitations of their activities. ASA4 is basically when there is a serious disease that is constant threat to their health, and it basically limits the activities of the person. The ASA5 basically includes a serious disease that their death can be expected within 24 hours with or without the treatment. So this is basically a classification on which the society basically decides whether the investigation has to be carried out or not, and basically the deaths that basically lies between ASA1 and ASA2 are the deaths that have to be investigated in particular, because in these groups basically there are no serious diseases that the person was suffering from.